Hello, I'm Dr. Sean Sierra-Patev. I'm a principal scientist down in the public health laboratory. I wanted to comment on at least how I've seen this affect the workings within the laboratory where I work. We have a constantly changing and expanding workload. Most of our work is dictated by our federal partners at the CDC, FDA, EPA, et cetera. And doing that work within the parameters that we've been assigned from them brings in a considerable amount of grant money, which funds the vast majority of our department and most of the public health laboratory work that we do in the state. Despite the workload increasing quite substantially because of the FTE cap, the employee load doesn't necessarily increase proportionally, which means those of us doing the work tend to take on quite a bit more capacity in that regard. And as things are progressing, as science is changing, we adopt quite a bit more automation, and we get more diversified in the work that we can do. But the supervisory requirement still represents a pretty significant hurdle for my members and for my peers in the laboratory, because it's very difficult for us to move laterally. A lot of people have talked about bumping up against that limit for their pay grade and then having to find a job in another department or in another sector, but you can't really do that in the laboratory. If you're a chemist, you're a chemist. If you're a molecular biologist, you're a molecular biologist. I'm a bioinformatician. I run the bioinformatics program, and I'm the only one. There is no other bioinformatics program to move to. So I'm very fortunate that during the recent changes in the job descriptions, the position that I currently occupy had been modified, and that verbiage that has been requested was included in this new position, may supervise instead of must supervise, which allowed me to move up and more accurately reflect the workload that I'm doing in other states in our peer laboratories. I would be supervising 2 or 3 or more bioinformatics technicians to be doing this work, but we're a smaller state and we are constrained by this cap, and so we cannot. So I do the work myself. When I was just a senior scientist, I would get strange looks and questions when I would attend our meetings with our peer states about that. I'm very lucky. Most of the positions are not, and it's very difficult to change these positions as they exist, and many of them have existed for quite a long time. So I am, of course, speaking in support of this change. I think it would be very beneficial for us to maintain the sort of staffing and capacity that we need to keep in compliance with the federal partners and to keep the grant money coming.
Thank you. Any questions?